yourselves on mute. And if you would like to speak, please hit the raise hand button. I believe we have that correct. But we can then get started. And for those who don't know, I'm Mary Quay. I'm the Associate Commissioner of Market Regulation and Professional Licensing at the MIA. And if you want to move to the next slide, please. This work group was created by House Bill 813 from last session, and it will extend through 2026. We will prepare an interim report and then a final report. And today is an introductory meeting to introduce everyone and to go over our plans. Akos is my co-chair from the Department of Health, and he will introduce himself.
Good afternoon, everyone. Like Mary said, I am Athos Alexandrou. I am the director of the Maryland Medicaid Pharmacy Program, and I'm really excited to participate in this work group. I would like to thank you in advance for your commitment to the work group, and I assure you that myself, as well as Secretary Seshmani and Medicaid Director Priskin, are committed to providing whatever support is needed for this work group. Thank you, and back to you, Mary.
Thank you. And I see that we have some legislators in attendance, and I would like to give them the opportunity to say a few words. Delegate Cullison.
Thank you very much, Madam Chair, Madam Co-Chair. I too want to add my thanks to the work group, and I'm very excited about the prospects of your discussion and the potential recommendations that you may make to us that are going to help us address some of the issues around the allowing our pharmacists to be adequately reimbursed for the work that they do, the important work that they do, as well as look at the way those decisions are made. So I appreciate the level of discussion we're going to be having over the next four meetings or so. So thank you very much, and please excuse me, I will have to step out, but I will step back in at some point.
Thank you. Senator Beidel.
Thank you, Mary. Thanks for managing the work group, for facilitating and bringing us all together. This is such an important issue. We've discussed it every year that I can remember since I've been on the Finance Committee. So I really look forward to working with you and maybe finding some solutions that will help our payers as well as our constituents and our pharmacies. Thank you.
And thank you. Delegate Hutchinson.
Good afternoon. Happy to be on the call here today, and glad to be part of this team, and hopefully we can come up with some good ideas. Thank you.
Thank you. And Delegate Gazzani.
Yes, thank you. I also, echoing my colleagues, am happy to be here and looking forward to kind of diving into what are clearly some thorny issues, and hopefully we can make some good progress. Thank you.
Thank you. I hope we can make some progress too. And can I have the next slide? Okay, we will proceed with work group member introductions. There is intentionally one representative in each category mentioned in House Bill 813. And if I can have the next slide. The bill sets out the interested stakeholders to be included in the work group. We have not yet found a member from each category, but we are close. We have 2 vacancies left. And next slide, please. Can we go down the list and each member can introduce themselves? So Ms. McCormick.
Hi, this is actually Stephanie Katz. I'm standing in for Ms. McCormick as she's unable to attend the meeting, but as Stephanie Katz of the National Association of Chain Drug Stores, and I am our Vice President of Reimbursement, Innovation, and Advocacy.
Mr. Weiner?
Hello, my name is Steve Weiner. I own 2 pharmacies in Baltimore City. We service primarily low-income subsidy patients, and we have a large Medicaid and Medicare Part D population at both of my locations.
Mr. Hose? Ms. Robinson?
Good afternoon, Kimberly Robinson with Care First Blue Cross Blue Shield. I serve as the Vice President for State Government Affairs.
I'm sorry, Mary. I think I was on mute, but
Okay.
apologize. I'm Brian Hose. I am the CEO of Epic Pharmacies, representing our PSAO Epic Pharmacy Network with hundreds of stores in Maryland that we contract for.
Okay. Ms. Lindahl?
Mayor Leah Lindahl, the Vice President of Government Affairs or State Government Affairs for the Healthcare Distribution Alliance. Happy to be here. So thanks.
Mr. Glasscock? Okay, can I have the next slide, please?
Thank you, Madam Chair. Darren Johnson with Amgen on behalf of the brand manufacturing industry, and happy to be part of the work group.
Thank you. Ms. Horton?
Hi, good afternoon. Aaliyah Horton. I am the Executive Director of the Maryland Pharmacists Association, the professional society for pharmacists in the state. Thank you. Looking forward to working with everyone.
Mr. Coppola?
Good afternoon, everyone. My name is Rob Coppola, and I am Vice President of MCO and Public Sector Sales with MedImpact, where I'm responsible for government strategy and regulated market as well. So glad to be here.
Mr. Hanson?
Good afternoon. My name is Alan Hansen. I'm a principal with Myers and Stauffer, and we provide Medicaid pharmacy reimbursement consulting and other auditing services to Medicaid programs, including the Maryland Department of Health. Thank you.
Ms. Fleming?
Good afternoon. I'm Meredith Fleming. I'm the Director of Pharmacy Network Management and Strategy with Carolyn RX under Anthem or Elevance Health and WellPoint.
Okay, and we also added the Maryland Board of Pharmacy as a participant.
Yes, good afternoon. Dina Spates-Napata, Executive Director of the Maryland Board of Pharmacy. Glad to be with you today.
And could I have the next slide, please? We do have some leads for a plan sponsor and a non-PBM mail order pharmacy participant, but we would like to hear of anyone else in the vacant categories who might be interested. And so we have the email there for the working group. And next slide. Athos and I have introduced ourselves, but could other people from the MIA and other state agencies introduce themselves? So, David?
Hello, I'm David Cooney. I'm the Associate Commissioner for Life and Health Insurance here at the MIA.
Paul? Jamie?
Hey, good afternoon, everyone. Jamie Sexton. I'm the Associate Commissioner of External Affairs here at the MIA.
Alyssa? Deanna?
Good afternoon, everyone. My name is Deanna Beebe. I'm a Health Policy Analyst Advanced here at the Office of Pharmacy Services, working under Athos and Dixit Shaw, and assist them on legislative issues such as this one.
Dixit?
Good afternoon, everyone. My name is Dixit Shaw. I'm a Deputy Director of Medicaid Pharmacy Programs.
Andrew?
Hi, Andrew York, Executive Director of the Maryland Prescription Drug Affordability Board.
And Christina.
I'm Christina Shackley. I'm a Health Policy Analyst Advanced here at the Maryland PDEB.
Okay, thank you, everyone. And the next slide, please. And the next slide. And so of the topics to be covered in 2025, House Bill 813 requires the work group to review coverage for specialty drugs and ERISA exemptions for pharmacy benefits management regulations. And we will start with these topics this year. Next slide. So here are the dates and times for our next meetings. The second meeting will be on Wednesday, September 17th, and the MIA will lead a review of ERISA application to PBM regulation. The following meetings will be in October. October 8th will begin the discussion of specialty drugs and data collection related to compliance with specific areas of state law. And those topics will continue into 2026. And on October 31st, we will present a draft interim report and accept public comments. So next slide. Again, we have our email here. This will be the dedicated email address to submit comments to for this meeting and following meetings or on the interim report. And we will accept comments for 2 weeks following each meeting. Next slide. And these are the dates for the development of the interim report so that we can stay on track to submit it on time by the end of the year. Next slide. The work group will continue into 2026. We do not have detailed plans yet, but here is what we expect. Next slide. We will continue to have public meetings that are open to the public. Meetings will continue after the end of the 2026 legislative session. We are planning monthly meetings, but dates will be set in 2026. The work group membership will remain the same, but if someone leaves their organization and needs to be replaced, the agency staff will consider appropriate replacements. The seats are held by individuals and not organizations. Next slide, please. In addition to the topics we will begin reviewing this year, House Bill 813 requires the group to review reimbursement for pharmacists with specific issues to consider. And these issues deal largely with payments under medical assistance, also known as Medicaid. Next slide. Other topics to be reviewed include the costs associated with pharmacies contracting with commercial plans versus medical assistance, and provisions of the insurance article related to anti-steering. Next slide. Okay, any questions from work group members? Steve?
I'm a little concerned about the order of what we're tackling in the work group. The legislation originally, from my recollection, dealt with Medicaid MCO reimbursement. Stores are accelerating in their closings, both independents and chains. And I'm very concerned about the ability of our citizens to maintain access to pharmacy services. The subject matter that we've chosen to tackle in 2025, let's say there's some sort of epiphany on specialty drugs. any recommendations or any legislation will not have an effect on ERISA plans. So anything done with that line of business, even if successful, will have very little effect. The ERISA plan discussion is long and tedious, and it's great that we're tackling it. We've discussed it for multiple years. If you look at the order of the study requirements, it lists number one. I think the very bottom sentence of number one says something about Medicaid pricing. Then if you look at number two, it lists MCO pricing. And 3 and 4 seem to be, an afterthought isn't the right word, but I believe part of it was because of an FTC hearing or paper that expressed some concern about specialty drug pricing that pharmacy or independent pharmacy has expressed for years, but the FTC brought it out, and that was sort of thrown in after the fact. So it just appears we're doing the fluff first and not the hard work that really could have an impact on member access and patient access across the state. It would seem that would be the more critical parts of why we were brought together for this important work. So thank you.
Thank you for those comments. Brian?
I'd like to echo Steve's comments that I feel like we're doing some of the work that's not going to have as big of an impact first. But along those lines, if we're going to be discussing ERISA at the next meeting, could we request that potentially someone from the Attorney General's office join us, since they've put in opinions on that legislation in the past?
I take it you mean well, our attorneys will be involved in the presentation. The MIA, let me rephrase that to be precise. The Assistant Attorneys General assigned to the MIA will be presenting on the ERISA issues. Did you mean them or different?
I know that we've gotten opinions asked from the Attorney General's office regarding this legislation that's been put into testimony, and I was hopeful that whoever worked on that could be present to discuss it with us.
Okay, I will raise that with our attorneys and make sure that the proper people are here. Thank you. Stephanie?
Yes, thank you so much. I just wanted to, echo Stephen's comments about a change in perhaps the order in which we're addressing these issues. The Medicaid-based issues are incredibly important, and from NACDS's member perspectives, of which there are many in the state, delaying is going to inevitably accelerate the closures we are already seeing in the pharmacy deserts and especially in the rural areas. So while I know it is resource heavy, I think the people on this work group are prepared to help assist, if you will, in that resource base. And we would really implore the working group and everyone on MIA to perhaps consider us readdressing the Medicaid issues first and not kicking that to 2026. We're not sure we will be able to sustain long enough to see those actions implemented.
Okay, thank you. Salim?
Thank you for giving me a chance. My name is Salim. I'm the president for the IPMD, which stands for Independent Pharmacies for Maryland. And I echo all the comments which are made by the previous speakers. And the pharmacies are really trying hard. They're struggling with the reimbursements, especially with the PBMs, the brand names. We are always underpaid. And this has to be corrected. Otherwise, the more and more pharmacy will be closing down the road.
Okay. Are there any other comments or questions from work group members? Okay, next slide. Any other questions or comments from public stakeholders? Aaliyah?
Sorry, thank you. I was trying to find my raise hand during the member comment period. I do echo the comments of the previous statements of the members of the work group regarding the order of the agenda. So just want to say ditto on that. The second piece is I wanted to find out the opportunity for other entities to participate, to perhaps provide information to the work group as part of our process. We have seen numerous reports from 3-Axis advisors who recently did some work with the Prescription Drug Affordability Board that I think can provide an insight on a number of these topics. And so wanted to find out if that would be an opportunity to invite them to present on some of the content.
Certainly, anyone is welcome and encouraged to submit comments through our email address and to come and speak publicly. We'd have to know more before we could talk about a presentation to the group. As far as being on the work group, we are quite intentional about having one member from each category. But certainly if someone has information to share, we encourage that.
Thank you.
Anyone else? Okay, next slide. I think we're about at the end. And this gives our email address again. Comments are open through the end of the day, Wednesday, September 10th. And we are open to anything discussed in today's meeting, including our plans for the future work of the work group. Next slide. And that is it. Thank you, everyone.
Thank you.
Thank you, Mary.
Thank you.
Thank you.